middle of your table and give it to the young lady in the blazer on that olive table, and she will give you a present, a little stress ball for all the stress I've caused you. But this helps us understand what our senior demographics look like, what age group, what background. So if you are a caregiver for a senior, you can fill it out. If you're 55 plus, you are technically a senior. If you look at there's different definitions for it. The AARP defines seniors as 55 plus. So anyways, I highly recommend you to do that little homework. If there's not enough surveys on your table, you can ask for more at our back table. She has more extra surveys as well. Okay, so we are going to get started in a few minutes, so please settle down. The highlight of today is that we do have delicious dinner, which will be served closer to 7:30. And what I would like you to do when dinner is served is quickly put the food in your plate and take your seat back, because we will continue the program, okay? Any questions for me? Okay. I'm going to introduce myself in a few minutes. Thank you, everyone, for coming. Yes. All right.
We are leaving right after the presentation. Will it be okay if I put like a bunch of files?
Sure. All right. Can everyone hear me okay? Hopefully it's not too loud now. Okay, then don't sit. Make sure you turn your chair. Thank you. I appreciate it. Of course. Of course. Alhamdulillah. Can everyone hear me okay? right. Can everyone hear me okay? Okay, perfect. Is this perfect volume, Uncle? You had pointed it out. This is better? Okay, much better. We're not disturbing the entire neighborhood and telling them what Medicare is, right? Okay, good. Well, welcome everyone for being here to our ICYL Family Night. This session is in collaboration with Olive Community Services and Islamic Relief. My name is Zainab Hussaini. I'm the program manager for Olive. I do programs for seniors and their families. Now, most people tell me I'm not a senior. I know. That's why we call our seniors Olivers. So we give them that little easier term so that they feel more comfortable. So today's presentation is going to have 3 parts. I'm going to tell you a little bit about Olive and why we are here today. Then we are going to talk about Medicare Essentials. We're going to take a short 10-minute break where you can plate your food. We have some delicious pasta and Philly cheesesteak sandwiches for you and salad. So quickly plate your food and come and take your seats, and you can eat while the second presentation goes on for caregiving resources. So today's session is not just for seniors, it's for people of all age groups, families. I'm sure each and every one of us in this room is either caring for someone or knows someone who might benefit from this information. So please, whatever you learn today, make sure you share it with your family members, your friends, your neighbors. I do these programs weekly in our site in Fullerton, and I'll share more about that. So again, this project has been funded by Islamic Relief Grant, and that's why we're doing the needs assessment survey on your table. So if you finish it today, you can return it to the lady in the back, the young lady in the blazer waving to you, and she will give you a little present, a stress ball for the stress that we've caused you to put up with that survey. But it really helps us, and I'll share you why. So Olive was started in 2016 by this group of young, almost retiring older adults in the Orange County area. They said, we're retiring, we need programs for us, for people like us. So that's how Olive basically started, by this big idea of doing things that are catered to the cultural and faith-based needs of seniors out there. And the mission of Olive is to have programs that promote health and wellness to seniors and their families, and also for the community. So we have a variety of programs. And we try to do a lot of health and wellness. Physical, emotional, and mental health is very important to us. Like I said, we call our seniors Olivers. So from now on, all of you in this room are an Oliver, officially. So there has been studies out there to better understand what we do. There are certain parts of the world that are called blue zones. These are places in the world where people are living 100 years plus. And they're living very healthy, long lives. So scientists went and tried to do studies in these areas and found out what is making these people live long, healthy lives. So these are the bottom 6 reasons why they're living long, healthy lives. You know, exercise, flu shot, treatments, clean air, all that good stuff. But the top 3 reasons, can everyone in this room on this side see? Okay, good. The top 3 reasons, number 3 is quit smoking. Number 2 is close relationships, meaning they're good ties with their friends and family. And social integration, meaning they're very connected to each other in their communities. And this is a map of all the blue zones in the world. One particular one in Italy is called Sardinia, where people are packed like sardines, literally, like they're living so close to each other. Everyone knows each other, checks on each other. And there is the Loma Linda area. Can anybody guess what is in your Loma Linda that's common, that makes people live longer? Any guesses? Huh? The university. So that university is actually owned by Seventh-day Adventists, and they eat a majority vegetarian diet. So, you know, again, it's a community of people who are eating this healthy food and also connected with each other. This is some pictures from our programs. We meet weekly. We have a little site in Fullerton, very close to Lemon and Commonwealth. And we meet weekly and do different types of programs, educational, fun, social programs. And now we're trying to bring it to different areas like mosques as well. This is a few more pictures. We go on hikes with different generations. We like to do story time with seniors and teenagers so that they can learn from each other. Special projects like creating a cookbook or making masks, and also visiting seniors at home, the ones who cannot leave their home spaces. So these are all our different programs, because we do get that question, what does Olive do? So most of our seniors are independent, active older adults, meaning they don't need a caregiver. And they're able to drive themselves. As we grow, we need to accommodate the people who are at a higher level of need. And hopefully, inshallah, we get to that level and provide need for every type or every need of senior. What makes Olive unique is we like to do multicultural programs, intergenerational programs, and serve people in a way that not only enhances their dignity and respect, but also, promotes their health and wellness. We want to encourage you to get out of your house and walk, have healthy relationships with your friends and neighbors. Don't feel isolated and, segregated from society. A little reality check for everyone. Aging in America is a real deal thing. This country is aging, as in it is getting older, not younger. If you look at the different statistics and different projections, by 2030, there will be an equal number of seniors and younger adults. And then by 2060, there will be more seniors in this country than younger people. So we're going to surpass that population. Right now, 1 in 6 Americans is 65 plus. By 2030, all the baby boomers, just in 8 years, all the baby boomers will be 65, and that will lead to 1 in 5 Americans being 65 plus. So the need for such programs is huge, and definitely something that all institutions should be looking into. As much as you're investing in your youth, you need to invest in your senior population. Now, majority seniors want to live at home, right? Who wants to live in a skilled nursing or assisted living situation? But to live at home, you have to have certain needs met. And that's why we are talking about this thing about aging in place, meaning you are aging in your own home, because that's the comfort zone. Now, to age in place, the proper definition is that you have to do it in a safely, independently, and comfortable manner. And it involves these 6 things. Okay, so this is a good note for every child of a senior in the room. Number 1, making sure you're socially engaged, being involved in programs like Olive, going to the gym, having regular meetups with your friends and neighbors. Backup help. What if something happens, like your roof is leaking, or you have a plumbing issue, or your gardener, there's some upkeep that needs to happen? You need to have that backup help. During the pandemic, a lot of our seniors were having issues getting groceries, getting a haircut. So that's where, they were counting on their children and their neighbors and their friends to help them. And having a plan for that is always a good idea. Upkeep, same thing, having a plumber on hand, a handyman on hand. These are small things, but very helpful. It takes away the stress if that's taken care of. Family members, letting know your children and your siblings or whatnot, if something were to happen to you, who's going to make the medical decisions for you? Those are things called advanced care directives. Having that done is very, very crucial. Having your estate planning done if you own a home or have some assets. So these are things that we really are pushing all of our Olivers to take on. Safety. If you have a restroom downstairs or not, the next time you are doing a renovation or remodel of your bathroom, making sure you have grab bars in your bathroom. These are important things to, again, think about for avoiding the risk of falls, because falls can lead to different things. Mobility. What if you have a hip replacement or some type of ortho surgery? You are not able to drive for 6-7 weeks. Do you have a backup plan for who's going to drive you, or do you have the funds to, if you want to hire an Uber or get the Octa Access buses and stuff? So these are things I want you to start thinking about, especially if you're an adult child of a senior, because these are the bare minimum things that could make their lives so much easier. And as they say, everything will be okay. Most of you in this room are healthy, safe, have your things put together. The moment when crisis hits is when that's the true test. So are we prepared for that crisis is the key question to ask. Again, cool pictures of some of our Olivers at home. They are doing fun things, having hobbies. This was during the pandemic. This Oliver likes to make cards. This Oliver likes to do painting on his iPad that his children got him. We have Olivers who like to do lectures for prisoners who don't have a khatib to come to, so he's in the prison outreach program, Imam Hafiz. We have Olivers doing gardening. So lots of cool things. And I'm going to conclude here with saying that Olive wants to connect you with the resources that the government has, the community has, and bring it to you so that it's easy access. And that's basically what Olive is trying to do here today. This is the survey that we are doing to get to know what your demographics look like. What's your age group? What's your background? How often do you work out? What's your income range? These are anonymous responses that can really help us understand what kind of needs are, do seniors need housing? Do they need education? What do they need? Do they need transport? So this survey will really help us. So before you leave today, if you could do one thing for me, finish that survey on your table and give it to the young lady in the back, and she will give you that present. So I really appreciate that. If you're not able to finish it, she does have envelopes that have stamps on them, and you can mail it at a later time. But please do that for me. And that's it. My name, again, like I said, my name is Zainab. If you're coming later, our information is in the back, and you are always welcome to contact Olive. Now, there's a few Olivers in the room. Can you please raise your hand? Yes, who have attended an Olive program in the past. These are very proud Olivers. Ask them, how is their experience? What do they enjoy? Have they seen anything help them? They attend our programs. The Ghoslas here have been attending. They're OG Olivers. They've been there from the very start, and many of you as well. They've attended programs, and ask them, what are the benefits you've seen in your own life? They have wonderful families, but having friends at Olive is a different experience for them. Without further ado, I'm going to bring in our next speaker. She is Lily Madani from HiCap, which is a nonprofit that does education about Medicare. Now, how many of you are already on Medicare? How many of you are about to be on Medicare? Okay, that's okay, that's okay. What is important for you to know is it's open enrollment time. And if you don't sign up for it in time, there's penalties. Can you believe it? There's a penalty for not signing up on Medicare on time. So with that, I'll ask Lily come over and share her presentation with you. Any questions for me before, while Lily's making her way up here? Yes. That's a question for Lily, and she will answer. December 7th. Oh, I love how Olivers know. That's great. Good job. Okay, any other questions for Olive-related questions? No? Okay, perfect. Welcome, Lily. Yes, that's the survey.
I'm on video. Are they taping?
Then they're live.
Okay. Live is all right, but please make sure they do not tape. Okay. And this gentleman wanted me to stay on that side. Okay. And who is watching the live?
Just audience members.
Okay. And no recording? Yeah. Please find out, because we are not allowed to have recordings. Okay, and no recording? Is there going to be recording? Okay. Salam alaikum, good evening. My name is Lily Madani, and I am here from Health Insurance Counseling and Advocacy Program. The short form is HICAP. We are a non-profit in Orange County. Before I start, I handed out this yellow paper. These are evaluation forms, anonymous. This will help me to do better in my next presentation. I would appreciate it if you fill out the questions at the end of the presentation and leave it for me. I'll take it with me. And I just want to know how I did. Tonight we are going to talk about Medicare. And I am coming from a non-profit organization called Council on Aging, and one of the programs is Health Insurance Counseling and Advocacy Program. We are part of the State Health Insurance Assistance Program. We are not insurance brokers. We don't sell any insurance, and we do not endorse any insurance products. We are just here to help. We are counselors, and we have counselors that are state registered and are here to answer your questions. If you have a bill, if you do not know basically what Medicare is, if you do not know when to sign up, how to sign up, we are here to help. Our call center and main office is in Irvine, next to John Wayne Airport. All of our appointments are one-on-one. And again, we are free, unbiased. We are just here to answer your questions. Our counselors speak multiple languages. So today we are talking about eligibility and requirement, different Medicare parts, and other insurance coverages, coverage options, plans, costs, and present some resources. And at the end, we will have a few minutes for questions and answers. And if you could please silent your phones, and if you have questions, if it's possible, just take a note and we'll answer the questions at the end. So first of all, let's see what is Medicare. Medicare is a federal health insurance program for individuals that are 65 and over. Even though some individuals that are younger can qualify for Medicare if have been on disability for more than 2 years, or if have been diagnosed with some chronic illnesses like ALS or ESRD. And one of the requirements is we either have to be a US citizen, or if we have been on green card, we have to have the green card for 5 consecutive years and have lived in this country for 5 consecutive years with green card. So how do we sign up for Medicare? Where do we sign up for Medicare and when? These are the questions that we try to answer tonight. And it is very confusing. Medicare is very complicated, very confusing, but we are here to help. So there are 2 methods that we can sign up for Medicare. Some people automatically are enrolled in Medicare without doing anything. Those are the individuals that have decided to retire before 65 and collect retirement. On the birthday month that they turn 65, they are automatically enrolled on Medicare by Social Security, and they will receive their Medicare cards in the mail. And again, the individuals that have been on disability for 2 years, 24 months, on the 25th month are automatically signed up for Medicare and they will receive their card in the mail. Also, the individuals that have been diagnosed with ALS, no matter what age they are. Other than these groups, rest of us must enroll in Medicare, and nobody is going to sign up us automatically. Where do we have to sign up, and who signs up? It's Social Security Administration. Once we want to sign up, we can go online, sign up online, or we can call Social Security and sign up over the phone, or we can go there in person and sign up. But the best would be to make a phone call to see how it is going to be the appointment. So when can we sign up? Can we sign up anytime? No, there are 3 different times, 3 different periods that we can sign up. The first opportunity for each individual is once they turn 65. So once we turn 65, our birthday month, 3 months before our birthday month, and 3 months after our birthday month, we can sign up for Medicare. So the 7 months surrounding our birthday month is the first opportunity we can sign up, and it's called initial enrollment period. Depending on the month that we sign up, our Medicare would start. And if you are under employee group health plan before 65 and contributing to your HSA accounts, and you are going to sign up for Medicare, you need to stop making contributions to the HSA account 6 months prior to being eligible for Medicare. There are going to be some tax consequences. So another opportunity that we can sign up is if we can get a special enrollment period. Sometimes we decide to continue work even after 65, and we want to be covered under our employee group health plan. So we can defer Medicare, meaning not to sign up for Medicare, and we continue to work. After, imagine 5 years, when we are 70, we decide to sign up for Medicare, or any time that we stop working and we lose the employee group health plan, we have a special enrollment period during 8 months that we can sign up and not to get penalties. Remember, if we don't sign up during the initial enrollment period, which is the first opportunity for us to sign up, and we don't have coverage through our employee group health plan, we will have penalties if we do not sign up. So the special enrollment period would allow us to sign up for Medicare without getting penalties. If we don't have a special enrollment period, and if for any reason we do not sign up for Medicare during the initial enrollment period, we need to wait till January, February, March of each year to sign up for Medicare during general enrollment period. So general enrollment period is the time that we can sign up. If we have lost the opportunity to sign up during the initial enrollment period, if we don't have a special enrollment period, then we can sign up for general enrollment period, but we again may have to pay penalties, late payment penalties, because we haven't signed up right on time. And during January, February, March, when we sign up, starting next year, 2023, the Medicare would start the month after. For example, if we sign up January and we are eligible, our Medicare would start the month after, on February. Some of the changes are happening to Medicare next year. This is one of the changes, that we don't have to wait for 6 months during the general enrollment, January, February, March. Anytime we sign up, we may have to pay penalties, but the Medicare would start the month after we start to sign up. So what are Medicare parts? We always hear people say Part A, Part B, Part C, Part D. What are the differences? Basically, Part A is the hospital insurance when we are admitted to hospital. Part B is medical insurance when we go to doctor's office, when we have blood tests, x-rays, or if doctor orders some durable medical equipment like wheelchairs and walkers, they are all covered under Part B. And once we have prescription drugs and we go to the pharmacy to fill out the prescription, we are using our Part D, D as in drug, and Part C is if we choose to go on a Medicare Advantage plan, would be Part C. So again, Part A is medical, is hospital, it could be inpatient care in a hospital or in a skilled nursing facility or hospice. And Part B is when we go to see doctors, doctor services, x-ray, preventive services. And Part D is for drugs. It's important to know which Part D to choose depending on our prescription drugs. We must be enrolled in Part A and Part B, or A or B, to be able to sign up for Part D. Part D is something that we have to sign up. Nobody signs us up. And also there are multiple plans available. And the key considerations, once we want to choose a Part D plan, we have to know what kind of prescription drugs, what tiers. Because of the payments, we have to know what is the payment structure for our Part D drug category. The pharmacies, we always have to choose the in-network pharmacies to pay less. And also the costs. Part D has its own premiums and deductibles. And also depending on the plan that we have. So what is Part C? Part C is Medicare Advantage. As we know, Medicare Advantages are HMOs and PPOs. As probably you have heard, some people may have Kaiser, some people may have a Scan, some people may have Blue Cross. These are HMOs or PPOs. And this is if we decide to go on a Medicare Advantage plan. If we go on a Medicare Advantage plan, Part A, hospital, Part B, doctor, and Part D, prescription drug are offered to us as a bundle, plus some extra benefits. So there are also a group of plans called supplemental plans. Some people get to choose to go on original Medicare and buy a supplemental plan or Medigap plan to cover the costs and the percentages that Medicare does not cover, meaning it would give us some extra help for the payments. So once we have Medicare and we already have some other insurances, we need to learn and to know how they coordinate. How Medicare coordinates with employee group health plans, retiree medical plans, COBRA, Veterans Affairs, and also Medi-Cal. So what are my options? There are so many options and I am confused which one to choose from, which one would be the best for me. So the first time that we are eligible for Medicare, we have two options. Option one is if we go on original Medicare, or traditionally it was called fee for service. We will get the Part A for hospital, B for doctor. We can add a Part D for prescription drug if we do not have any. If we don't have any and we don't buy a Part D once we are eligible, then we would have penalties. So make sure you know all the rules. And then if we want, we can add a supplement insurance or a Medigap to help pay with the costs. Option two for us, once we go on Medicare, once we are new to Medicare, is going on a Medicare Advantage plan. Medicare Advantages are, as I mentioned, HMOs and PPOs. They offer Part A hospital, Part B doctor, and most plans, majority of the plans, offer Part D, which is drug, all as a bundle. They also, so meaning we have only one card for our Part A, Part B, and Part D. plus our Medicare card. And some of them offer extra benefits like dental, vision, and some extra benefits. So key considerations, which one to choose, which one is better? We cannot say there is a one plan fits all. Depending on your need and what you like, you can choose between original Medicare, which has more flexibility. Once you're on original Medicare, you can go see any doctor, any health provider that accepts Medicare and get their services. You don't have to wait to get a referral from your primary care to see a specialist. And also it's accepted in other states, but you have to remember about the costs. Option 2, if you go on to Medicare Advantage, you are limited within the network of that plan. Meaning if you have an HMO plan, there is a network, you only need to go to that network to pay less out of pocket. If you go out of network, you have to pay more. These could be HMOs, PPOs, and you also need to get a referral if you need to see a specialist. And these are regionally based, meaning over Orange County, and some costs also is a factor you have in mind. I know these are all confusing. If you have questions, we can answer your questions. I know it's a lot of information. And let's discuss about some considerations that we have to have in mind. Some of the services are not covered by Medicare. Those services are dental, vision, hearing, foot, meaning once we go to see a podiatrist, those are not covered under Medicare. Over-the-counter medications like vitamins and some of the medications that do not need a prescription are not covered under Medicare. Foreign travel not covered, also long-term care not covered by Medicare. Let's talk about something. People say, this is what I have, this is the plan I have, can I change it, or should I or am I stuck with it for the rest of my life? No, you can change. If you're not happy what you have, you can always change, or sometimes you can try, and if you don't like it, change to another thing. So there are some periods that you can change. The first opportunity is Medicare annual election period, which is October 15 to December 7th. It's known as Medicare open enrollment period. We are on open enrollment period. If you are on Medicare and you want to change or you want to review what you have, this is the time to make the change, to review. And the changes will begin January 1st of next year. If you need help and assistance, we have free counseling appointments. You can sign up. They are in person. They are happening in different senior centers and in our office in Irvine. It's important that you review what you have. Even if you are happy with what you have and all of your medications are covered, you still need to review, because there might be another plan that's cheaper and you will save money, or some things may change next year. The prescription drug plan that you have this year might not cover your drugs next year, or the doctor, your favorite doctor and specialist that you've seen this year might not be contracted with your plan next year. It's important to review what you have this year to make sure all of your healthcare needs are met. We can help you with that. Another period you can change is the Medicare Advantage open enrollment period, which is January, February, March of each year. This is for the beneficiaries that are already on Medicare Advantage, if they want to change to another Medicare Advantage, or if they want to change prescription drug, and in some cases they can change to original Medicare, but they might lose the opportunity to avoid going to through underwriting to get a Medigap policy. And also a special enrollment period, we talked about it a bit, or if you sometimes move from one area to another, for example, if you move from Orange County to LA County or from San Diego County to Orange County, you are entitled to a special enrollment period. You can change during that time, and other situations may apply. So there, like any other insurance, Medicare has premiums and co-pays and co-insurances that we have to pay. Most of us get the original Medicare. Most of us get the Part A for free. If we have worked in this country for 10 plus years and have earned 40 plus credits, we can get the Part A, which is hospital, for free. We all have to pay premiums for Part B. This year, Part B premium is $170. It is going down next year, meaning 2023, it's going to be $164.90, meaning it's going to go down around $5 monthly. Also, Part D premium is changing, and some of the deductibles are changing. So there have been some changes happening 2023. You can call us, or you can go to medicare.gov website to get all of the information. So there are some programs that help you save money. One of them are the MSP and Extra Help. These are the programs that help pay for prescription drugs, and also these are to help pay for co-payments and premiums. Yes. Okay. Okay. All right. Okay. Sure. Let me know. You're welcome. Okay. All right. I have 5 more minutes. Or less than that? Okay. So I have some brochures about these programs. MSP, these are for limited income and limited asset. If you think you may qualify, give us a call, or more than welcome to grab the brochure. These are all about this program. We also have one brochure about people that are on Medicare and Medi-Cal and different options. So we can help you sign up for these programs, the savings programs, if you need help. There are ways to save for your prescription drug, and these are the resources. This is our number. This is our local number, 714-560-0424. These are the website for government agencies. Also, those are you that are on Medicare might have received this booklet. This is a very good source of information. I know you receive a lot of paperwork, and you get tired, you toss most of them, but please do not toss this one. This is coming from Medicare. You might, those that are on Medicare might have received the new version, which is 2023. Please keep it. It has all the information about the plans, and those that received the Southern California version, if you turn the back, this is our number. We are here to help you, health insurance counseling and advocacy program. I will talk just a minute about Medicare fraud and abuse. Like anything else, Medicare fraud and abuse is out there. We have to be careful not to be the victim. Treat your Medicare card like a credit card. Don't share the number with anyone. And it may look like just a paper card, but treat it like your credit card. Don't share the information with anybody. And if somebody wants to give you a gift to sign you up for a health insurance plan, make sure that you do your homework before you sign up for anything that you are not familiar with. So that was the end of my presentation. Thank you so much for the opportunity. This is our information. And I tried to give at least one of the flyers to every table. If you have any questions, give us a call. Thank you so much.
All right, at this time, I'm going to ask all of you to quickly go and make your plate for dinner. I'll give you 10 minutes and come back and get seated. I think Isha is closer to 8:15. We have another quick 30-minute presentation while you're eating, okay? And then we'll be done for the night. There's dinner in the back. We'll have 2 rows.
الله أكبر الله
All right, so let's get started so that we end in time. That's one thing I really want with Olive program, start on time and on time. Thank you, everyone. Are you enjoying your food? Is it okay, approved? Oliver approved? Okay, something different. When I came in, one of the Olivers said, oh, there's no biryani? I said, oh. But now she's taken her words back. She said she loves it. Okay. Yes. Shukriya, thank you. Okay, so for my young and the restless who love to pay Isha on time, Isha will be at 8:30, okay? So enjoy your food and make sure you ask our speaker here all the questions you want to ask. Some people asked me, where is the food from? It's from Mana's Catering, okay? And Philly cheesesteak sandwich and Alfredo chicken pasta. You have to have some, Gabby, too, okay? There was another request. One of the Olivers wanted to hear from another Oliver. I'm going to take this mic to that dear Oliver in the audience. Ismail uncle? You just have to say a few words. Why do you like Olive and what did you like about the programs you've attended?
Why you pick me up?
I love it.
Okay, the Oliver, I'm not regular Oliver, but many time I go for like walk and all those kind of thing, outdoor thing, and that really help because you meet people and learn a lot of things. And they also have a regular program just started. We had a second meeting with most of the professional like engineers and type of people, and we enjoyed getting together. So I guess that's about it. And
Are you going to go back is the question? Yes? Okay. All right. So I want to introduce our next speaker, Gabby Vendryes. She's from Caregiver OC. This is a great resource that is literally in our neighborhood, in our backyard at St. Jude Medical Center. They provide amazing services for caregivers, meaning anybody who is taking care of somebody, a loved one. It could be a parent, a spouse, or whatnot. So great free resource, and Gabby is going to share with you all the free services they provide. So please pay attention. I know you're enjoying your meal. Continue to do that. You can go back for seconds, of course. But full attention to our speaker here. Welcome, Gabby. Round of applause for her, please.